how do you decide between medication management and surgery like DBS for Parkinson's patients, right? So is it everybody, is it more of a progressive stage? So then we decide to go in DBS or a surgery, so especially, I mean, how long a patient can manage with medical medications, right? And then before they decide to go into something like DBS.
So usually the DBS or the Parkinson's disease patients are primarily treated by neurologists, and the first goal of treatment is to replace the dopamine, right? So we very clearly know that there is a deficiency of dopamine in the brain which has caused this. Is there a scan or something which can tell us? Now there is some increasing use of what is called as a PET scan. We inject the dopamine into the patient's body and then do what is called as a positron emission tomography or a PET scan, in which these areas in the brain, which is called as the substantia nigra, where the dopamine is concentrated,
Yes.
do not light up. So then we know that there is a deficiency. So that way we diagnose. So the first line of treatment is obviously replacing the dopamine. So as soon as you're diagnosed with Parkinson's, definitely we don't do surgery. Usually what happens in Parkinson's disease, since it's a progressive neurodegenerative disease, over a period of time, usually that is about 3 to 4 years, they start developing more and more symptoms in spite of being on medications. So that is the time when we start thinking about deep brain stimulation. So that's the time when we start talking to the patient. See, now we are giving you almost 5, 6, 7 doses of these medicines. We have added one more medicine. We have added a third medicine. Still, you are not getting the benefit. You're still having only the effect for 1 or 2 hours. That's the time we start thinking about surgery. And if we find anything during this 3 to 4 years which suggests that this is not only Parkinson's, but the syndrome which mimics Parkinson's, like I told you, they're all called Parkinson plus. So if it is a condition which is like Parkinson's plus, then you automatically don't qualify for any kind of surgical intervention.
If this sparked a thought, imagine the full conversation. Tap to subscribe and explore with us.